A very good afternoon and welcome to the session on the topic lifestyle and fertility. We are glad to have Dr. Sita Sharma, Senior Consultant, Apollo Fertility Amritsar, among us today to understand the topic. And the doctor will take us through the session more in detail. So if you have any doubt, any queries, post that on the comment section and be there till the last, as the doctor will be taking questions in the last of the session, and also you don't miss out any important part of the session. Doctor, you have the stage.
Yeah, thank you so much. Good afternoon, viewers. I am Dr. Sita Sharma, Senior Consultant from Apollo Fertility, Amritsar. Today, I am taking a very important and very routine topic. How does your lifestyle is going to have impact on your fertility, or lifestyle and fertility, how they are connected to each other? So what changes you should do in your lifestyle to boost up your fertility? So what is fertility? Fertility is a potential to conceive. Of course, it is a couple problem. It is not either a female problem or it is a male problem, but it is a couple problem. So when we are talking about fertility or infertility, infertility is the inability to conceive. When you are trying for conception without using any mode of contraception, you are trying to conceive to become pregnant for at least 1 year. So 1 year of using not using any contraception, you are trying to conceive and you are not able to conceive at the end of 1 year, then we label this problem as infertility. So but now I'm not here to discuss about the infertility more. I'm here to discuss about few facts and few things you can do to boost your fertility, so that you are not able to encounter this problem of infertility. So I'll be talking about both the partners, male as well as female partner, and I'll be taking small steps to improve your lifestyle one by one. And there are some factors which are not in our hand, we cannot control them. For example, age. You are aging, your ovary is also aging, so your this potential to become pregnant is decreasing with age, but you cannot control your age. So there are some factors which you can do, we'll discuss those. For example, if you are having diabetes, hypertension, कोई medical illness है, जहाँ आपको कोई फाइब्रॉइड है, एंडोमेट्रियोसिस है, कोई पॉलिप है, तो these things are not in your control, so we cannot control them. So we will discuss today the factors which are in your hand, you can control them to increase your chances to become pregnant early. First and the foremost, the thing is weight. Weight in both partners, male as well as female. In my daily OPD, I am encountering patients who are having heavy weight. Weight, और in other words, आजकल हम लोग बात करते हैं तो BMI की. BMI आपका 18 to 25 तक नॉर्मल मानते हैं. इफ यू आर अंडर वेट, आपका BMI 18 से कम है. जहाँ यू आर ओवर वेट, आपका BMI जो है वो 25 से ज्यादा है, बॉडी मास इंडेक्स अगर वो ज्यादा है, तो फिर भी आपको प्रॉब्लम हो सकती है कंसीव करने में. सो वेट इज वेरी इंपॉर्टेंट. यू शुड हैव ऑप्टिमम वेट अकॉर्डिंग टू योर हाइट एंड अकॉर्डिंग टू योर वर्क स्टाइल. अगर मैं बात करूं, वैसे तो आजकल यू कैन फाइंड मेनी एप्स जिनके ऊपर आपको आपकी हाइट के मुताबिक वेट कितना होना चाहिए, यू विल बी इजिली फाइंडिंग देम. बट अगर मोटे मोटे तौर पे जस्ट ग्रॉसली आई टॉक अबाउट यू कि कितना वेट होना चाहिए. in case of males, if your height in inches is should be your weight. Like if your height in inches is say 60 inches, 5 feet आपकी height है, and your height in inches becomes 60, then your weight should be around 60 only. It is smaller, lesser in females. In 1 inch is equal to 800 grams, we say. So roughly अगर जितनी आपकी height in inches है, उतना ही आपका weight होना चाहिए. This is a rough formula to calculate, but nowadays IT का ज़माना है, तो you can calculate, you can find out the apps जहाँ पर आपको आपके लाइफस्टाइल के मुताबिक, आपकी हाइट के मुताबिक you can find out what is your ideal weight. So आजकल we are encountering most of the patients are young girls or patients coming with the problem of infertility, not able to conceive, with weight, overweight, and the normal common problem seen in the people is PCOD. And most of the people or most of the girls are aware about PCOD, polycystic ovarian syndrome, PCOS. So this problem have hormonal problem. It is not a true cyst. There are some pseudocysts. You can say that basically a large ovary contains plenty of numerous follicles, which are causing you hormonal problem. Because of this hormonal problem, you are having menstrual problem, and because of this PCOS, you are having ovulation problem. You are not getting ovulation. Egg नहीं बनता है ovary के अंदर commonly. That is why you are encountering the problem of infertility. So PCOS is very common in our part of the country. It is the weight is causing hormonal problem. That is why you are not able to conceive. On the counterpart, if you are underweight, if you are very thin, that there can be PCOS again. PCOS has two varieties. One variety, the patient becomes overweight or obese. In the other variety, the patient is thin. It is thin lean PCOS. So even then you can have hormonal problem and you can find difficulty in conceiving. And when I come to the male partner, if the male is obese or male is overweight, they can also take long time to make the partner pregnant, or there can be infertility in male partner also. There can be defect in the hormonal cycle of the male, that is spermatogenesis, जहाँ पे sperm formation होते हैं वहाँ पे defect हो सकता है. And they also have difficulty in performance also. So overweight will affect both male and female partner. And now the next important topic is STDs, sexually transmitted diseases. These are the diseases which go from one partner to the other partner through the sexual relationship. Husband से wife को जब one partner से other partner को जा सकती हैं. And in this patient, most of the times the female comes with the problem of chronic pelvic pain. Lower abdomen में continuously pain होता रहता है. And there can be chlamydia and gonorrhea kind of two organisms which cause chronic pelvic pain, chronic pelvic infections, and they can damage your tubes later on, and they can lead on to infertility. So you should use protection at the right time to avoid all these problems. Next important part is in the society or in the young generation is smoking. So smoking is very bad for fertility. I'll say no to smoking because smoking is a big cause of infertility. It causes DNA damage to the sperms. If I talk about male infertility first, it causes DNA damage to the sperms. The mitochondria are powerhouse of the sperm. They give energy to the sperm for motility. So they will lead on, the smoking will cause the sperm, damage the sperms in morphology, number. So smoking is very bad for the sperm health. And also there are reactive oxygen species are formed which will further damage the sperm quality as well as the quantity. And the smoking is also causing problem to the females, because in the modern societies the females are also having smoking habits, and also the passive smoking can also affect the partner. So the ovarian reserve is decreased. Ovarian reserve, that means the number of eggs in the ovary. Usually the number of eggs in the ovary decreases with age. After the age of 37 years, the ovarian reserves start decreasing steeply. एकदम से कम होना शुरू हो जाता है ovarian reserve. And number of eggs अगर ovary में कम होंगे तो naturally your chances to become pregnant will be very very less. So ovarian reserve, it is seen that with age, of course, the smoking also decreases the ovarian reserve. And also if there is any pregnancy, this chances of miscarriage, chances of getting abnormal pregnancies like ectopic pregnancies also commonly seen in the women who are smoking. Another, like smoking, there is another lifestyle activity. It is alcohol. Alcohol is very bad for females because it disturbs the ovulation function, and it has very bad effect on the fetus if you are having, wish to become pregnant during that period. So, and in males it causes defects in the spermatogenesis, it decreases the count, it decreases the motility, and again there is defective sperm function, and there is a defective, and there is the problem of infertility goes on increasing because of the male partner as well, because indulging in alcohol, this thing. And then very important another point is about the exercise. And once optimum weight is important. When we talk about the weight, if we advise the patient to go for decrease in weight, so there will be two factors, important factors or important things the patient will do. One is diet and other is exercise. Active lifestyle is very important. for your day-to-day activity. And even if I talk about the fertility problem, the active lifestyle is very, very important. If you are indulging into heavy, very heavy exercise, that is also bad. And if the males are taking androgens for muscle building gym, जिनको जिम जाने की आदत होती है, जैसे muscle building के लिए they are using androgens which are male hormones, they have a very bad effect on your fertility. So don't ever use them. Moderate amount of exercise is very, very important for your fertility, for your body functioning. And it is said that if you decrease, if you exercise for 1 hour in a day, and you exercise for 3 days, 3 days in a week, not the whole week, so this is sufficient for your normal hormonal functions. If you indulge in excessive exercise, or if you are having a sedentary lifestyle, like the persons who works in the IT, or who work in some office, banks, जिनको sitting job ज़्यादा है, sedentary lifestyle, तो उनके अंदर hormonal problems, weight and other medical problems बढ़ जाते हैं. That is why they can have more, they can find more difficult to conceive. So you should have a active lifestyle, and you should have moderate kind of activity, moderate kind of exercise you must do to maintain your body weight ideal, and also to have your hormonal value normal. And another factor I would like to discuss at this point is our environmental factors, because अगर occupation की बात करें तो there are some occupational hazards जिनके कारण जो है infertility की problem बढ़ जाती है. For example, nowadays it is very it is very because it has become necessary to carry some gadgets with us, like mobile phones, laptops. So because the work is done on those gadgets only, so I will advise all males to not to keep a mobile phone in their pant pocket, trousers pocket all the time, because the nature has created scrotum which contains the testes, male organs, in such a way that they are not lying inside the body. Body temperature is 37 degrees centigrade, and they are lying outside the body to maintain the temperature 2 degree lesser than the body. So when you are keeping your mobile phones, or if you are working on your laptop and you're keeping the laptop on your lap, so that is the heat generated will is going to transmit it to the testes, and they going to hinder with the hormonal production and going to hinder with the spermatogenesis, that is the sperm formation. So avoid using keeping the mobile phone in your pant pocket, and avoid using laptop in your lab. Rather make it a table, keep it on the table, or keep it on somewhere like slight distance from your body. Another is heat. I'm talking about the heat. To avoid male husband should avoid going for steam bath or sauna bath, and then they should avoid use of pesticides, because the pesticides are also dangerous for the sperm functions. And heat, you may be knowing that some patients have the testes are not descended inside the scrotum. The testes lie inside the body. We call it as undescended testes. Undescended testes, they are exposed to the body temperature, that is 37 degrees centigrade, for the longer time. They can also have defective spermatogenesis and defects in the sperm formation. So heat is not good. Even you should not use very hot water for your daily bath, and avoid wearing tight undergarments. And because tight undergarments are, again, the problem will be that the testes will become close to the body, and they will be exposed to for longer time to the heat. So avoid wearing this tight undergarments, nylon undergarments, and avoid using heat bath. Avoid having working in the working in heat environment for a longer hours. All these changes are reversible, if you just take care, and if you become aware about these things, and next time you take care about all these things. Do not wear undergarments which are very tight, or do not have a very hot bath or steam bath, or then just you can change your habit of keeping the mobile phone in your upper pocket. So all these things, these are reversible, these are not irreversible. The damage caused will come back because the lifestyle of the sperm or spermatogenesis is 72 to 74 days, and after that they are stored in the epididymis so that the changes will come back to normal. So these are the environmental factor. Another environmental factor, sometimes these are the radiation which are emitted from the mobile phones, your gadgets, even microwave. You should not stay very close to the microwave, but these are microwave work is only for 1 minute or 2 minutes. That is not very bad, but you should stay away from the microwave. And then it is known that microwave also emits some kind of radiations. And there are other form of radiation which is called ionizing radiation, which are used in the medical field. Some patients diagnosed with the cancer, and they are going to have treatment like radiotherapy. In those cases, the sperms or even the eggs in the ovaries, they are also going to damage, because there will be then the doctor advise them to make their semen or eggs stored in the IVF lab before going for their further treatment like radiotherapy. So we can go for social freezing in those cases. You can say it is fertility preservation techniques, which we can maintain the fertility. We can save the ovary or from the radiation effect, or we can freeze 2-3 samples of semen so that further in life you can go for making your family. So the use of androgens, excessive androgens like in the gym, that is also becoming a lifestyle that is also bad for the testosterone function and also the function of the sperms. Now, one important factor with day-to-day activity I have encountered in male and in female, the stress is very high. Stress of not becoming pregnant and stress from the family, peer pressure. मेल में अलग तरह का स्ट्रेस होता है, स्ट्रेस ऑफ नॉन परफॉर्मेंस, स्ट्रेस ऑफ नॉट अचीविंग प्रेगनेंसी, और स्ट्रेस और सम अदर जॉब स्ट्रेस, वर्क प्लेस स्ट्रेस. So the stress in the body is again further going to harm your fertility potential. There is excessive secretion of the hormone cortisol, which will further derange or make your hormones non-functional, or maybe there can be imbalance in the hormones, and there will be again the infertility problem will rise. And when you are talking about the work, and there are आजकल ऐसे भी काम है जहाँ नाइट शिफ्ट भी लगती है. So if you are working in a night shift, then again your body's circadian rhythm is disturbed. During the sleep, our body repairs the damage at the cellular level. So sleep is very important for maintaining the normal function of the body, including the sexual functions and fertility functions. So we have to have good amount of sleep. Even if you are working in the night, anytime you should have at least 7 to 8 hours of the sleep during the day hours, so that your body start functioning, or body get a boost for the next day functioning. So I'll end my session with a few advice to the females and to the males also. If I talk about the males, again, ideal weight is very important for both male partner and female partner. You should have optimum weight, and you should do moderate exercise. Do not use these androgens or any other fancy products to build up your muscles. Diet is very important. Diet for both the partners is very, very important. Avoid eating processed foods. Avoid taking lots of limcas and these cold drinks apart from alcohol I have discussed. So don't take so much of the processed foods and juices and artificially flavored juices. And you should take natural foods. Take natural fast food rather than man-made fast foods जिनको हम बोलते ही junk food है. So don't take that. टेक नेचुरल फास्ट फूड लाइक नट्स लीजिए, पल्सेस लीजिए, वेजिटेबल्स लीजिए, फ्रूट्स लीजिए. टेक लॉट्स ऑफ एटलीस्ट 1 सर्विंग ऑफ द फ्रूट्स एंड सैलड शुड बी देयर. पल्सेस को आप स्प्राउट्स बना के लीजिए. टेक लॉट्स ऑफ फ्लूइड्स, नेचुरल फ्लूइड्स. टेक मिल्क, टेक लस्सी, टेक दिस नारियल पानी. So all these things you should take in plenty. Take the seeds which are available to us by nature. Take pulses. So you should have a normal diet. And then if I talk about the diet for female, and I'm not a dietitian, but I'll just tell you, you should, when to maintain your ideal weight, you should avoid taking lots of carbohydrate. Maida, refined flour, you should avoid taking. You should avoid taking excessive fat and excessive sugar and excessive salt. So no excessive salt, no excessive sugar, no excessive fatty acids. So all the excess things are bad. So avoid cutting your sugar down. So you can use natural products like stevia or no sugar at all. So that will help in decreasing your sugar intake, and this sugar intake will help decreasing the formation of fats from the sugar. When you take excess sugar, the body utilize in the formation of fat. लोग कहते हैं हम oil और fat तो खाते ही नहीं है, पता नहीं हम कहाँ से मोटे हो जाते हैं. The sugar also is a culprit. This is also known as white poison. So refrain from the sugary items as well. So take lots of fluids, lots of good diet, lots of green vegetables. And when you are planning for pregnancy, start taking folic acid tablets. 400 microgram is the requirement of folic acid per day. So take your prenatal vitamins, and you can take vitamin D as well. Do good exercise. Don't indulge into smoking and alcohol. I'm talking about both the partners now. Don't indulge into smoking and alcohol, and take care about your body. Don't be a target for sexually transmitted diseases, and then take care about the environmental and your occupational factors. You cannot change your occupation, लेकिन आप अपना ध्यान रख सकते हैं. अगर if you are in night shift, then take good sleep. If you are having a work, like if you have to work in heated environment, then try to keep your body cool. Then don't take too much of this steam bath or hot water. Wear proper undergarments, keep your body clean, and always do yoga or meditation. ऑलवेज बूस्ट ईच अदर. दोनों पार्टनर्स एक दूसरे को कभी डांस कर सकते हैं, वॉक पे जा सकते हैं टुगेदर, सो दैट यू कैन हैव, इफ योर लाइफ स्टाइल इज सच दैट यू आर ऑलवेज सिटिंग बिफोर द कंप्यूटर और लैपटॉप सारा दिन करते हैं, तो जस्ट टेक आउट एटलीस्ट हाफ एन आवर और 1 hour आउट ऑफ योर बिजी शेड्यूल. गो विद योर पार्टनर, गो फॉर ए वॉक, योगा कर लीजिए. योगा इज वेरी गुड फॉर योर मेंटल हेल्थ एंड फिजिकल हेल्थ. And also you can go for even dance ही कर सकते हैं. Even if you can use your steps rather than using the lift all the time. So if you're talking on a phone, just keep moving when you're talking on the phone, so that little small steps will take you towards a healthy life and healthy and fertility wali life. So don't indulge into all these habits. You can change your life, you can change your fertility potential with your little small efforts. Thank you so much. You can ask me any question if you have in your mind. I'm here to answer that. I think there are no questions. Thank you so much. Thank you.